jamesibechi.com.
I want to use this opportunity to make a general appeal to the public, to people in Benue State. We have invested heavily in establishing this laboratory because we have Benue people at heart. I'm aware that a lot of people rush from here to Abuja, even for medical examination, and some other conditions such as cardiovascular, renal, and so forth. We have attempted to establish this thing because we want to have our people treated at home. The medical officers that are working are doing tremendous work. Our government is unable to provide this cutting-edge equipment for diagnosis. And I regard diagnosis as the center piece of medical practice and treatment. So we want to reduce to the barest minimum the need for Benue people to travel to Abuja. In fact, only privileged people can go to Abuja to check on their health. Majority cannot afford to go to Abuja. So we are here for them. And therefore, if the areas that are of concern to us and to anybody who has reached the age of maturity, who has reached the middle age, shall we say 50 years on, should be able to periodically check on his health status. For adults, for elderly men, for middle-aged people, the areas that are that we should care for most is our heart condition, cardiovascular condition, kidney performance. There are other liver particularly. That okay. So we should be able to monitor this thing. At least go for a medical check. Don't wait to be sick. Don't wait until it's too late to go for medical advice. On your own, come to a facility like this and you'll be given all the information, what your health status really is. If you can do that twice a year, it will aid us tremendously. Those people, some who are dying, could well have been saved if they took a preemptive step. So we encourage people to come, check themselves up, carry our results from here, go to a medical doctor, your doctor, ask him, this is what you discover about your health condition. He will be able to advise you what next to do. It is also advisable that everybody, this one is important, everybody should know his blood group or her blood group. Nowadays, when you go to motor park to travel, they take your name, they take your number, they say what blood group are you in. Many people don't know their blood group. In an event of an accident, they rush you to the nearest hospital, they say blood, he needs blood. Is that okay? They look at your resume, the information, they cannot tell your blood group, they will not be able to help you. Because it takes time to establish your blood group as a sick person on the on the bed, before they can now look for somebody, even if they have blood in the bank. It takes time for the health workers to establish your blood group before they can treat you.
And somebody can die too late.
Young women, or for everybody this time, young people should be able to know their genotype. I think genotype is the blood group. Phenotype is a blood group. Genotype, they should know their genotype. It's also very helpful in emergency situations. And women particularly, I would advise that they come here to determine their RH factor. RH factor. It's a complicated this thing to explain to ordinary people. But if you are going to marry and you have an RH factor that is similar, negative, fine. Yes, if it is positive, you are in danger, because if you meet a man who is also positive, that's okay. You are not likely to ever have a stable pregnancy. Because the moment the pregnancy comes on, antibodies or the immune systems will rise up against it. They will destroy it even at the formative stage. So a lot of people who are complaining, finding difficulty in securing pregnancy, if they don't investigate themselves to this level, I know in our African society they'll be blaming somebody in the village. Whereas it is your biological makeup. So this one particularly, you do it once in your lifetime. It's not something you will repeat. In fact, like I mentioned, once you know your blood group, you don't need to be repeating it. You know your blood group, that is your blood group. You know your phenotype, that is your phenotype. Genotype, you know it is once and for all. RH factor, just like sickle cell, anemia, the genes for it. If you carry the genes for sickle cell, establish yourself. I think that one, a lot of people now know something about sickle cell disease, and they go to hospital to check. Both man and woman, male and female, should establish their status in terms of a sickle cell condition, so that you don't marry, have children, and all of the 100% sicklers. Is that okay? So this is what we advise and plead with the public to take advantage of our presidency. We can do more, but I think these are the areas of serious concern every time. Areas of serious concern. Let our elderly people come and check themselves. That's our appeal. We are not after money here, we are after service. Is that okay? If you come here and we think that you are truly not be able to pay the charge, there's no problem. We'll run it for you so that you can go. So that is our service here. We place service before anything else. We are not here to make money. We are here to generate enough money to sustain the lab as it is. So that's my last appeal. And I'll be very glad if the public can respond to this favorably. We don't want people to be rushing to Abuja. Don't want people to be rushing outside Benue State. We now can do what they are doing out there. So thank you very much.
Thank you so much, sir.